All right, so that's my story. I'd be happy to take some questions about this. Yes, ma'am. My favorite part is the Q&A.
Thank you so much. This has been so informative. I have been seeing a lot of people, even at a young age, being, I guess, diagnosed with Crohn's disease.
That's my practice specialty, and we're going to talk about it tomorrow.
And
yeah, it's an autoimmune disease.
And they're 7 years old, and they're being prescribed Remicade for years.
Yep.
So I don't know if it's something I should wait on, or if
yeah. Are you going to be here tomorrow? Yeah, because I'm going to talk about it. I have one that was born with Crohn's disease, taken to the hospital with a bloody diaper at 7 days old. So yeah, the age is coming down. I'll tell you more about that later. But yeah. Yes, ma'am.
You had small intestinal bacterial overgrowth on one of the slides. Can you make some comments about that?
It's just another way that gut bacteria end up where it's not supposed to be, and beneficial bacteria are wiped out. It's really not a separate disease. You treat it the same way that you treat the whole gut problem. You have to clean up the diet. You got to stop using antibiotics if you can. There are a lot of plant antimicrobials that you can use instead of antibiotics, and it's advisable to do that. And then start eating a good diet, and eventually you can clean up that problem. So people have turned it into a separate condition because there's more money in it, obviously, if you do that. But it's really not. Let's take somebody over here. There you go. And I'll move back from here, okay? We'll make sure we get some depth into this. Yes, ma'am.
Are there times when you have an acute inflammation and you try to do it on your own and it doesn't work, and you do take antibiotics, but the doctor says you have to take the full course? And I've not done that. When I start to feel better, I wait another day, and then I figure my immune system will take over. And
the evidence is clear that you should not take the full dose. Everybody always said, and I've written articles about this, but the medical journals, several articles saying that, and particularly in this day and age. See, what's happening is is we're seeing now C. diff in community settings, MRSA in community settings. You don't have to go to a hospital to get C. diff or MRSA anymore. So this idea that you take the full course of antibiotics, most people don't need to do that. So yeah, you're doing the right thing. Okay, let's get somebody right over here. No, you were looking at, yeah, you who were turning around. We're going to do you next. There you go.
Hello, I was just wondering whether or not you have a similar study on chronic fatigue syndrome, ME, the same way you have for MS.
Chronic fatigue syndrome is interesting. It's often accompanied by irritable bowel, which is different from inflammatory bowel, which we're going to talk about tomorrow. Both of those conditions have a very strong psychological component, and often the patients will not get better. And I'm going to make some statements, and it may bother some of you, but I just kind of tell it like it is. One of the problems that you have with patients who have chronic fatigue and irritable bowel, but particularly chronic fatigue, is secondary gain. So people get to the place where it's better for them to be sick in their mind than it is for them to be well, which means that they're very resistant to the idea of getting well. So there was some discussion when Dr. Campbell was up here about psychological connections with illness, and it's a big one. And in almost every chronic fatigue patient I have worked with, what the pattern of behavior seems to be is extremely high overachieving type of people, mostly women, who at some point in time have some abrupt, they almost know when the line of demarcation is, when their health starts to decline. And they get to the place where they are completely non-functional. Now, I've seen men like this too, and they fall into the same profile. They then go to a lot of doctors, and part of the problem is that most of the advice they get is terrible. But even so, they don't get better, and they don't get any better in my office either, unless we deal with what is it that caused you to think that it was easier to be sick than it is to be healthy. And so this isn't a character defect. I want to make this very clear. In one case, I had a young man who was in my office with chronic fatigue, and after hearing the story of these overbearing parents who were pushing him to be an athletic superstar when the guy wanted to be a plumber or whatever, I would have gone to bed and not gotten up too. I'm serious. I understand where it came from, but you got to fix that, because what happens in the mind is that this black and white perfectionistic thinking thing steps in, where I have two choices: stay in bed or go back to that. Well, those aren't the only two choices, but when you have that type of cognitive distortion, you're not going to fix it until somebody helps you resolve it. So there are exceptions, obviously, to the rule, and there are some people who change their diets and get better, and chronic fatigue patients need to. But I've had quite a few vegan chronic fatigue patients who weren't any better from eating a vegan diet because the mental issue was not resolved. Okay? Yes, right there, yellow. Yeah.
When it comes to the probiotics, when I look at the probiotics aisle, there's refrigerated, not refrigerated,
Yeah.
50 billion, 150 billion.
Yeah. You need
how
to,
do I know how much billions and refrigerated
well, you got
not
to. You have to work with somebody. Most of the people, I would say probably 95% of the people coming in my office who take a probiotic are either taking something. They're usually taking something that can't possibly help them, either because it's such low potency they're on track to heal their gut by the year 2081, or it's got so much stuff in it that they're hurting themselves instead of helping themselves. And so we sell probiotics in our office, and the only reason we do, I tell people, I will give you instructions to go get one, or you can get them here. The advantage of getting them here is that we have them shipped just in time from the factory, you don't have much degradation if you get them the next day and that sort of thing. So that's why we have them, but we are very specific about types. So you can go buy one on your own, you can get them from us, but you have to get the right, as you said, number of billion, the right strains, and then you have to step it up. In other words, the product you start with is not going to be the product you end up with. So we'll talk about that tomorrow with the GI stuff. We'll get into that a lot more. The refrigerated, not refrigerated doesn't make as much difference as the length of time between when they leave the factory and you put them in your mouth. Okay? A refrigerated product that's been on the shelves for 6 months is just as bad as one it's probably worse than a non-refrigerated product that you put, that came from the factory 4 weeks ago. Okay. Let's go in the back over there. The guy with his hand up right there. Yeah.
Thank you, Dr. Popper. 2 questions. One, I heard you recommend or suggest True North for someone with type 1 diabetes. So for that individual, we have a friend that with True North followed by a whole food plant-based diet, how much would that help, number one? And number two, we have another friend who has, I believe it's called Mercer's disease, which I think is an autoimmune disease. Mm-hmm. How much would they benefit from a whole food plant-based diet, and do they need to consider gluten-free, do you think? Any
autoimmune patient, in my opinion, should have not gluten-free, but restricted and eliminating those brow foods. All of them, okay? All autoimmune patients. In terms of True North, I don't think True North will fast a type 1 diabetic because it's not safe. They can do juice fasting, but they have to eat. But having said that, accepting the type 1 diabetics, most autoimmune patients would benefit from fasting if they had the opportunity to do it. Having said that, also, we have many people who get well and never go fast. I mean, the vast majority of our people do not go fast, and they still experience health improvement. Okay, who's next? Let's do you next. I've got you right. You're getting your exercise today. It'd be nice if I just took them in a row, right? Yeah, well.
Hi. Hello. I have 2 quick questions. I always thought that you had enough probiotics in your gut if you ate a very good whole plant-based food diet. And the other one, I was just shocked. I had never heard that you could stop an antibiotic course midstream.
Yeah. Let's start with the diet. See, the issue with the microbiome is that these are not part of your body. These critters are renting space from you. They're renters, all right? And so this is like when people say, I'm going to eat well and hope to repopulate my gut, that's like saying my tenant moved out of the apartment building, I'm going to stand on the sidewalk and hope somebody shows up tomorrow morning living there. You got to go get a tenant, all right? So you have to, at a certain level of destruction, you have to replace. The appendix used to be the backup source. Like in the days when we used to get cholera and you'd have diarrhea, uncontrollable diarrhea, if you survived, you get some repopulation from the appendix, but we have an epidemic of appendices being taken out that shouldn't be taken out, and the level of antibiotic treatment is so horrific now that even that's being wiped out, so you're gonna have to take the probiotics, okay? And your other question again?
I'm shocked. I've never heard that you
Oh,
can
the
stop
antibiotics.
an antibiotic.
Yeah, well, again, most medical practices don't follow the evidence, which is why it's so important to make informed decisions and do the research yourself. And so what we're trying to do, our end game, and we do it with all of the people who we work with, is that informed consent in the healthcare business usually means doctors tell you what to do, we call that informing, and you say okay, and we call that consenting. And then later on, you find out what the medical research shows really should be going on. So these articles that I've been reading for the last 10 years about the fact that it's not important to finish the whole regimen. But once something becomes a practice, one of the problems we have in medical training is that you have people who practice medicine teaching people who are going to practice medicine. Now, there's some good in that. But what also happens is a lot of bad habits get passed down from generation to generation. It's really hard to break the cycle, and that's why some of this stuff continues. Okay. I'm going to make it easy on you right next to her. There you go.
I have two questions too, if you can answer both.
I'll try to remember the second one. You know,
right. The first one is that my mother, she's had a persistent itch in her ear for some time. It comes and goes, and she's gone to the ENT and to the allergist, and they haven't been able to help her get it better. So I'm thinking it might be something in her diet that's causing it.
It might be, or it may be that she's got some yeast in her ear that would be causing it. That could be something too. I mean, I don't know. It's hard for me to diagnose stuff from the stage, but
I should suggest her to go to a nutritionist, I guess, or
well, I think you have to go to somebody who knows something about this stuff. I mean, the flavor of the person is not as important as the evidence-based nature of what they do. And by the way, we were having a discussion earlier about this labeling. Okay, so people say, well, is what you do naturopathic? Well, I'm a recovering naturopath, just so you know. I try very hard to leave my training behind so I don't hurt people, all right? But so I think a lot of naturopathy is terrible. I think a lot of traditional medicine is terrible. I think what you have to do is say, we don't care where it comes from. We care what the evidence says about the particular thing that we're looking at. The same thing is true with the type of practitioner. I mean, I've met athletic trainers who know more about how to help people recover from musculoskeletal injuries than orthopedic doctors. Right? So what you're looking for is people who are competent, and they're out there. I mean, we're there. You know, so you just want to get people who are competent and follow evidence and interview them. You know, people interview babysitters. People interview people who walk their dogs, for crying out loud. Interview people who are going to do medical intervention with you. So what's your second question?
I wanted to ask you about what's your thoughts about vaccinating children?
Well,
right now?
I don't have any thoughts about anything. This is an evidence-based discussion. Nobody should care what I think about anything. Okay, so let's just look at what the evidence says. And this is, again, a really controversial issue. And we're going to have a very robust talk about this at our fall conference in Columbus, because I invited Cheryl Atkinson to speak, who's done a lot. She's an investigative reporter who's worked on this issue. Here's the problem with vaccinations. The first thing is we know they don't work. The flu vaccine efficacy rate is 10% this year. It is now clear there were 150 outbreaks of mumps reported by health departments, and so you know what the CDC says? We're going to have to give more boosters. Okay? Right now, whooping cough has been outbreaks in 49 states. They estimate that the vaccine lasts for a year. I mean, if we're going to use vaccines to prevent these diseases, eventually we're all going to be walking around with an IV drip bag, okay? The second thing is that the medical journals are quite clear. I wrote a 5 or 6 page article on tetanus. You know, the tetanus infection rate started dropping in 1870. So the vaccine didn't get introduced till 1947, and everybody says that we're preventing tetanus because of the vaccine. Well, that's clearly simply not true. And I'm not talking about third world country medical journals. I'm talking about the Journal of the American Medical Association, New England Journal of Medicine, et cetera. So these vaccines, number one, are not responsible for reduction in infectious disease for the most part. They don't work for the most part. And how many people know that there's a court that administers claims for vaccines? Okay, most of the people in the room don't. Most people who come to see me don't. So this is a great plan. A few decades ago, back, I think it was 1990, shortly before then, the federal government entered into an agreement with the vaccine companies to exempt them from any liability for the damage their products cause. and then they charge a tax on the vaccines, and it goes into a fund, and it's paid out through a court. Now, 99% of the people in this country don't know about this court, and everybody claims there's no problem, but they've paid out $3.4 billion in claims. That's a lot of money for a problem we claim not to have. And also, when most people don't know they can file a claim, it's the shortest statute of limitations of any court in the country. Now, I want to ask you this. How many people would want to buy a car if the federal government entered into an agreement with automobile manufacturers to hold them harmless from any damage their cars do? So if the brakes don't work, or they spin out of control, or whatever, or things blow up, then we just collect $250 tax per car and put it in a fund, and all the people who get hurt driving defective cars can file a claim. How many people would buy a car under those circumstances? So here's where I am on the issue. There's so much fraud and deception. When I tell you fraud and deception, you have no idea. That guy, Paul Offit, they put up there as the poster child, he owns a patent on a vaccine with Merck, and he was on the vaccine committee at the CDC that determined the schedule. I mean, this is criminal activity, in my opinion. So I think we have to stop this nonsense. Stop it. Do the right research, and then see if we're going to go forward. That's not, what are the odds it's going to happen? None. But that's what I think needs to be done. And I'll keep talking about it, and maybe we'll start a revolution and actually do it, you know? Yes, ma'am, right over here.
I was diagnosed with Hashimoto's about 12 years ago and was told that I have to stay on Synthroid for the rest of my life. Now, I'd like to get off. I don't know the best way to wean myself off. I know a plant-based diet will help, but do I stop this?
You may not be able to get off. Okay, it just depends on what your antibody levels were and what your health status is. And so when you start, I think it's very important not to promise things that you can't deliver. So when we start down the path with somebody like you, what we're going to do is we're going to do everything we can, first of all, to make sure you don't get another autoimmune disease, because if you're not doing all the right things, you're prone to get another one. Then what we'll do is see how far we get with that. And if we can reduce, that we can try some reductions in medication. But after 12 years, I can't say that you would be able to get off medication. You might not. But if it's a lower dose and you don't get more autoimmune diseases, we still win, right? Okay, yes, you here.
Can you say more about when you said chronic fatigue was psychological, and then you said the same thing with irritable bowel? Can you comment on the irritable bowel?
It's the same thing, and you see the same pattern. The people who have just irritable bowel usually stay functional, as in they're going to work and that sort of thing. But they, and again, I'm generalizing, there are exceptions to the rule, but the people with irritable bowel, they're still going to work and school and all that kind of thing, but they're always looking for the bathroom and talking about the limitations on what they can eat, and they stay home from work and they're sick, and it's a pattern. And just to be honest, my mother had this pattern. The only way my mother knew how to get attention was to be sick. And if you proposed anything that would actually get her well, she was highly resistant to that idea, okay? Particularly if it came from me. All right, so in case any of you are feeling bad because you haven't been able to convince your family and friends, I have not been able to convince my family and friends. My father, by the way, eats this diet and is 87 years old, takes no drugs. His IQ is higher than his cholesterol, so he listened. But the rest of the family, not so much. The rest of my friends, not so much. So anyway, okay, right here. Thank you so much for doing this.
I had asked before about this, but someone with lots of allergies and like esophagitis, depression, what would you say about that? He's got, like my son, he's got oral allergy syndrome, so he can't eat raw stuff, and so he's across the board with nuts and soy.
Well, we have to figure out what's causing it. You have to get to the root cause. Right?
That's what I'm wondering. Like it's a
right. Well, and I don't know what the root cause is because I can't figure that out from here.
Right.
I'll say something about depression, and I'll talk about it in a general sense. So, just so you know, there is no such thing as a chemical imbalance in the brain that causes any psychological disorder. No such thing. The study that was used for the justified drugging 25% of the population was a study that was done on rats who appeared to be depressed. I've always wondered how you can tell if a rat is depressed. On autopsy, they ground up the brain and assayed the material and found out that the depressed rats were low in serotonin. Now that is, by the way, the only way we know how much serotonin is in your brain is to grind it up and assay the material, which we do not recommend, all right? Never sent anybody for that test ever in 22 years. Okay, so where this came from, one of my business partners is Dr. Peter Bregan in Ithaca, New York, the psychiatrist who never has drugged anybody in 50-some years. He's called the Conscience of Psychiatry because he started speaking out about this in the beginning. And essentially, psychiatrists had gotten themselves into a bit of a spot because of some of their terrible practices. I mean, these are the people that lobotomized one of the Kennedy kids and were doing electroshock in the mental institutions and making deals with prisoners to lobotomize them. If they would agree to it, they'd go free, but they lied about it. So they had lost a lot of their reputation, and they got the idea that if they could wear white coats and prescribe drugs like real doctors, then they could gain their prestige back, and the drug companies essentially accommodated them. The outcomes on the drugs are far worse. There is no chemical imbalance in the brain, but if you take the drugs, you'll end up with one, and that's all of them, ranging from ADHD to antipsychotics. Getting off of them is difficult. It's harder to stop taking Xanax than it is to stop taking heroin. So it has to be done very gradually. We got the first course approved through our school called Why and How to Withdraw from Psychiatric Drugs to teach practitioners how to take people off the drugs, because the psychiatry profession is pretty hostile to the idea in general. Don't let anybody drug you or your kids for psychological issues. What most psychological issues are is distorted thinking that has some origin in something that happened to people. And many people get in trouble. I mean, I've had periods of time in my life where I wasn't very happy about a lot of things. I didn't need drugs. I needed to talk to somebody. I needed time in the case of grieving over a death, something of that nature. So the answer is not drugging. And the problem we have right now, 25% of the people in the country take the drugs. It is the leading cause of disability. We put 850 adults and 250 children a day on disability due to these drugs. It's a financial behemoth this country can't afford. And so, yeah, we could talk a lot about that. I mean, I'll be around for the weekend so we can talk more. How do you find out what's causing it? You have to sit down and talk to somebody who has a clue. How you find it out is you got to sit down. How I find out is people submit history. People fill out a lot of forms when they come into my office. And we have a lot of discussion, and or by phone if it's not in my office, and we figure out what happened. I mean, unfortunately, right now, the 7-minute doctor visits, you give me a symptom and I'll give you a drug, or you go to the naturopath, you give me a symptom and I'll give you a supplement, has totally displaced the discussion about what happened to you. What happened to you? And when did it start? And you know something? People know a lot about their health. When I tell people, tell me the beginning of your story, and they almost know exactly the beginning of the story. A woman will sit in my office or will be on the phone and she'll say, you know, I started having irregular menstrual periods in college, and then this happened, and then this happened, and then this happened, and then these 7 things happened, and then, you know, here we are right today. So you have to start looking at what happened to the person, and then you can start to figure out how to fix what happened to the person. All right, so there are no shortcuts. I mean, you just have to do this work, and it takes time, and the medical system, as we've set it up right now, doesn't really allow much time for it, which is very unfortunate. So just one more thing. I think we're out of time for questions, but I am going to come over here, sign books. I'll talk to you for as long as you want to talk. I'll stay around after the panel discussion. I put out a newsletter on Monday that has an article about health. It's free. I put out video clips on Tuesdays and Thursdays, free. You can sign up when I'll put my sign-up sheet there. Feel free to sign up for the free stuff, and thank you so much for listening.